Today we are at Rectory Meadow Surgery and we are doing a lung event which is around both lung cancer risk factors and also targeted lung health screening and general health education in regard to lung disease. I'm Dr. Mallard Smith. I'm a GP of 30 years and I was a member of the primary care network that is responsible for this event today. But I have recently retired from my partnership and I am now the cancer lead for Mid-Chiltern Primary Care Networks. I have an interest in cancer of all types and I became the Mid-Chiltern Primary Care Network lead for cancer, and I felt it was important to actually try and educate patients in our network on a cancer that's not well publicised or promoted in the media in general, which has a very detrimental outcome should you get it in the late stages.
An event like this means that we're bringing a bit of proactive work to the patients rather than them coming to us with ideas. As a clinician, I've seen what proactive care can actually mean for patients, and it felt like a good event to bring to the local community and to team up with Roy Castle, who are absolutely fantastic in talking about lung cancer as well.
Roy Castle, who was a celebrity at the time, was diagnosed with lung cancer. He was actually a non-smoker, so it highlighted the fact that people who are not smokers actually can and do catch lung cancer. The foundation helps people in many different ways, from raising awareness in the community to lung cancer, raising awareness of the signs and symptoms and the early diagnosis of lung cancer. Not just that, what we also have is a bank of lung cancer nurses who offer support, whether that be medical, physical or emotional. So we run our support groups in a number of different ways. Sometimes it can be on the phone, so we have a keep in touch service where some of our colleagues or patients, ambassadors, will ring people who have been recently diagnosed and just keep in touch with them generally. We also offer online services such as breathing techniques, emotional support wellbeing, and also on the telephone. So what we're asking for is anybody in the Amersham area, High Wycombe, if they are diagnosed with lung cancer and they feel they can benefit from a group session, please get in touch and we will look to arrange something. So we have a number of different ways that people can reach out to our charity. We have the website, which is www.roycastle.org. We also have telephone numbers and emails. Again, if you visit www.roycastle.org, you can find more information there.
Targeted lung health screening is really important at this point in time for our population because the screening programme is being rolled out across the area. If you embark and take part in it, we'll show that it can diagnose lung cancer at a much earlier stage with a far better outcome of survival.
Nationally, lung cancer was being found around about 80% at stage 4 prior to screening. So the problem with stage 4 is it's late and it limits the treatment that can be offered. And when we talk about signs and symptoms, lung cancer is a really mean cancer in the sense that your symptoms won't come on until the late stages. So by then you've probably turned up at A&E because you've got an issue with your heart or something else is going on, and then they'll go, oh, by the way, we found this now. Since screening's come into play, again, this is nationally speaking, and we've actually turned the numbers on its head. We're finding low stages 1 and 2 by about 80% now.
Symptoms which are worrying. Now, these are the symptoms that you need to present with to your GP. The main one is a cough. If you have a new cough for longer than 4 to 6 weeks, you should present to your GP. Hemoptysis, that's just the posh word for basically coughing up blood. Weight loss, and the fourth one is if you feel constantly exhausted all the time. So what can you do? You can stop smoking by looking after your weight, keeping active, embarking on NHS health checks which help with cardiovascular health, and stop drinking or reduce your drinking.
So I think our biggest message today for everyone who's found out they're eligible for lung screening, and that will be patients who are from the age of 55 to 74, is to attend the lung screening. It is not a scary thing. We've talked a lot around how it could help save lives, and that's what we're here to do today.
We talk through your lung health, your general health, any asbestos exposure that you may have had in the past, your smoking history, so whether you're an ex-smoker or a current smoker, and any family history, or if you've been diagnosed with a cancer at all, and any chest symptoms that you may have. And as part of those questions, we then determine your risk and whether you're considered high risk, and if so, then we go ahead and request a scan for you. If not, then we touch base with you again in 2 years' time. The screening normally takes 5 to 10 minutes. It's very straightforward. We'd like you to be honest with us as much as possible so that we can get an accurate record of your risk. And it's all over the telephone, so you don't have to come to the hospital. So this is a patient experience following the lung cancer screening. So over the past year, my journey has been quite significant. Prior to my appointment, I wasn't experiencing any symptoms at all. When I received the invitation for screening, I decided to attend as a precaution, recognising the importance of early detection due to my age, the fact I was a smoker, and ongoing chest symptoms. The initial assessment and scan was straightforward and reassuring. The staff were professional, kind, and explained everything clearly, which helped ease any nerves I had. The scan itself was quick and painless. Following the first scan, I was contacted and informed that something had been detected that required further investigation. While this was understandably worrying, the process moved quickly, and I felt well supported throughout. Additional tests confirmed the need for surgery. Following the surgery, it was confirmed to be a cancer, yet I still wasn't experiencing any symptoms. My experience with surgery was positive overall. The medical team took excellent care of me. Recovery took some time, as expected, but I was well supported with clear guidance and follow-up care. I then started a course of chemotherapy for 3 months. Gradually, I was able to return to my normal routine. Since then, I have had ongoing monitoring and follow-up appointments. Thankfully, I have not required extensive additional treatment, but I remain under regular medication to ensure everything continues to progress well. Looking back, I am incredibly grateful that I attended the screening. It led to early detection and treatment, which made a significant difference to my outcome. I would strongly encourage others to take up the opportunity if they are invited, especially as I was living with cancer, but with no symptoms. Thank you.
So the main takeaway message I would want everybody to remember from today is that if you get called for a targeted lung health check in the area, please do engage. It's a very simple process and a very quick screening, and it could save your life. And also, the other thing to take away is that the Roy Castle Foundation is there to support you if you have a diagnosis of lung cancer or any lung condition that you would like support with.